Okay, it's 11 o'clock. Let's start. Well, welcome everybody. We're delighted to have so many people here today. And welcome to our Mental Health in Maritime, Creating a Culture of Care webinar. The Creating a Culture of Care is a project we're delivering as part of the Mental Health in Maritime objectives. The Mental Health in Maritime Network was established in May 2020 as part of the Diversity in Maritime programme, and today's webinar is to provide you a bit of background about the project and some next steps. We've got a fabulous panel here. There will be an opportunity for questions at the end, so do please feel free to use the Q&A function. And we will also put our contact details in the chat afterwards. If you think of any questions afterwards, let us know. This webinar will also be recorded, so if you do need to dip in, dip out, please do not worry. So first of all, I'd like to introduce Caitlin to everybody. Caitlin is the Vice Chair of our network and will be hosting today. Over to you, Caitlin.
Thanks, Chrissy. As Chrissy said, I'm the Vice Chair of the Mental Health and Maritime Network, and leading this Culture of Care project group. So just to give you a little bit of an idea about the aims of the project, the widest aim really is to develop a toolkit to help organisations to work towards a culture of care, aligning with the Thriving at Work core standards, and in particular core standard 2, which is to develop mental health awareness among employees, core standard 4 to provide your employees with good working conditions, and core standard 5 to promote effective people management. The project group has come together, volunteers across the industry have come together for one introductory meeting so far. So we've discussed the project aims, looked at our areas of focus, and really looked at how we can start to work towards a culture of care, how we can bring together the right resources and the right support to help organisations make this happen. And part of the how was a series of webinars and learning sessions that we thought were a really great opportunity to work towards some of the goals, especially when it comes to particular areas that we want to raise awareness around, and looking at breaking down the stigma associated with mental ill health, looking at why that happens, particularly within the industry and across wider society, and to ensure that the maritime industry is aware of the resources and the support that exists for employees and organisations. So this is a really great opportunity to do that. And so this is the first of what will hopefully be many informative webinars and the opportunity for more people across the industry to get involved in our project group and the network more widely. Please let Chrissy know if you're not already part of the Mental Health and Maritime Network or the diversity networks, and do get involved if you like. So we also have the opportunity to speak to a number of organisations across the industry that are already very committed to working towards a culture of care and to get some ideas of best practice. So without saying much more, I'm going to hand over to Stu Pollard, who is the chair of the Mental Health Maritime Network, to talk about what he's been doing and to talk about the project he's leading for the holistic approach. So thanks, Stu.
Thanks, Caitlin. So just to give people an idea of where we are taking the mental health group, as you've just heard from Caitlin, the culture of care is all about the Thriving at Work standards and the core standards 2, 4, and 5. The complementary and the other group that we've got is really focusing on the holistic approach and kind of tackles the other core standards within the Thriving at Work, which really focus on the organisational outputs and everything else, and making sure that the paperwork or the elements that the organisation needs to achieve to demonstrate that they are doing something within the mental health space. So it's kind of the two sides of the same coin, as it were, with respect to the mental health group and how we're sort of moving forward. To complement that, what we are trying to do is encourage the different sectors within Maritime to engage with the group and kind of feed the information up from you guys as organisations to the sector organisations that you may already belong to, and then feed that up into Maritime UK. So there is one kind of approach, one voice, but many voices, and everybody's voice is heard in the same way. To give you an idea of what we're trying to achieve there is that port skills and safety within the port sector has committed to engaging with the mental health group for Maritime UK to share the information that they are doing across the port sector, but take things and down the line and feed them into the port sector and what they're trying to achieve within PSS and across the ports, and also to allow the port organisations to showcase back up to us to say, this is the fantastic work that we're doing to fulfil these elements and that side of things. So we've started within the port sector and that side of things. So we're looking at trying to get the other areas within Maritime UK to do something similar. And that way, hopefully, there's one common approach and one common theme, as it were, that we're trying to do, but allow the organisations the space and area to be able to deliver what they need to deliver and make it work for their own organisations and take it through that way. So that's kind of how this all fits in to everything. So back to the culture of care. And what we are doing within this organisation. So we have really started the journey around about 3 years ago, and it was kind of a stop-start journey. People at the time said, "Oh, we've got mental health first aiders." Yes, we do have mental health first aiders within the organisation. So it's a kind of demonstration that we are engaged and we are trying to look after our people within the organisation. However, there were elements that were missing. So the first mental health first aiders didn't necessarily have the support from an outside counsellor or an organisation that they could go and talk to, because of the information that they are finding out about an individual. They had nowhere to offload that. You can't automatically share every single piece of information to health and safety or HR and that side of things. You need to keep some of that information confidential and get the support that you need to be able to allow that conversation to be done confidentially so that you can offload that information to someone and not be a burden to yourself and that side of things. So that's kind of the first elements of where we started with the mental health first aiders and improving the support for them. Similarly, at the same time, what we are now doing and starting, and it's really been encouraged by the pledge that we've punted out at the beginning of March to all organisations, and that's to really focus on our line management teams and allow them to have the training and the knowledge to be able to spot those signs of somebody having potential mental health issues or scenarios that are affecting them within the workplace, and allowing them to either talk about them, signpost them to a mental health first aider, or allowing them to have a talk to somebody that they may need to talk to, but also perhaps giving them the space that they need to be able to deal with the situation away from the work, because it might not necessarily be a work situation, and allow that to happen as well. We've encouraged that and started to try and open the freedom of open conversations, having a caring, trusting environment. Hopefully most of you have seen the film that we put out of Time to Talk Day, and that was really focusing on attempting to break down the stigma and allowing people to talk about their mental health issues. And we were trying to do that from a positive aspect, rather than oh woe is me type thing, but people talking about their own experience, their lived experiences of having mental health issues or situations that are affecting their mental health that may only be temporary or may be a continuing aspect of their life. But it was to be enabled to have that open conversation, to begin that conversation as well. So it was that type of approach that we are now starting to use as an organisation to really open people's minds, attitudes, behaviours towards mental health, and us as an organisation support them within it. Caitlin, do you need anything more than that, or I'm open to questions, interrogation, or anything else like that? So
that's perfect, thanks Stu. I mean, I think it would be really great to move on and hear from Laura at GAC, and I think that they'll I mean, to the attendees, please do ask questions, use the Q&A function as much as you like, but it might be that we have a number of questions after all of the panelists, I think. But thanks so much to Laura. Would you like to tell us about the initiatives at DAC, and maybe draw on some of the parallels with the PLA are doing, anything else that you feel you've been doing in addition would be great to hear about.
Thank you, and thanks Stu. I think like Stu's mentioned, like we really recognised, and it started within GAC probably around the beginning of 2019, that we really recognised the importance of mental health awareness, of people understanding that mental health is as important as physical health when it comes to our people. So for us, I'm introduced what my role is. I'm the Quality, Health and Safety, Security and Environment Manager, very long title for GAC. And I work really closely with our HR department, and we started looking at our strategies around our people, because we really do recognise that our people are our most important asset in what we do within the shipping industry, within the maritime industry. So we really understood that we needed to protect their mental health as well as their physical health from a safety perspective, but also promote good health and well-being on both physically and mentally, to encourage people to have all the things that we talk about a lot and you hear: work-life balance, to be able to feel satisfied in their role, to be able to be good participants in what they do both at work and at home. So we looked a lot at how we were going to roll this initiative out within the business. And so we started off by setting up a wellbeing working group, which is made up of people from across GAC UK at all levels. So we've got members of the senior management team, we've got agents, we've got operations staff, we've got support services staff. And we wanted to make it a really open and welcoming space, excuse me, where people's role or responsibility within the business is irrelevant to that group. We're all people. And we're all people on an equal playing field that have care and interest in mental health, in well-being, in promoting good mental health within the business. So we really made it an equaliser for us all to have real open and frank discussions as a group about how we could form a strategy moving forward. All of the group is made up of volunteers, so they're all people who expressed an interest in being part of this. They've all been trained now as mental health first aiders. And we have 12 members of that group with a start workforce of 200. Our plan is to train one mental health first aider as a minimum per office by the end of this year. So that's part of our strategy. But following on from what Stuart said, we understand that just training people isn't enough. Providing mental health first aiders isn't enough. You need to support the mental health first aiders too, so they can really feel that this understanding that there is somewhere for them to turn to and someone for them to talk about. So that's part of what our wellbeing group does. We're also there to come up with initiatives to discuss things that we could engage the staff with, build a community within our business, so people know that they have somewhere to turn, but they also have some light relief in conversation. And I will mention COVID because I think it's been really important. So using the facilities we've got to build that sense of community electronically and virtually within the business, which I think has been quite successful. We have offices, 25 offices across the UK, Ireland and Gibraltar. So it keeps us very closer together. There's people that I would probably only get to see once or twice a year, but now weekly we have conversations and and chats about all manner of subjects which aren't just work related. So we've started things like we have a music club where we review an album every 2 weeks. We have another lunch club where we talk about gaming, and there's lots of different things that are being released that just kind of encourage people to stay in touch. We're also really, we have a charity that we work with every 3 years. So at the end of 2019, beginning of 2020, we were selecting our charity. Our staff voted for us to support Mind in England and Wales and SAMH in Scotland. So it was a big flag to us that mental health was really important to our people. So we've continued that work. We have run, in the last year, we run mental health for managers workshops between myself and our HR manager, who are both mental health first aiders, to introduce to our managers or anyone with people management responsibility, so managers, supervisors, line managers, signs to look for, ways to have open, non-judgmental conversations with people, reviewing active listening and discussing with our managers how to actively listen to someone, to hear what they're saying, to give them the space to have an open and honest conversation about mental health. And for those managers not to feel awkward about that. We talked a lot about stigma and breaking down the stigma of mental health within our company. We've also reviewed our employee assistance programs and our health insurance that we have, or health program that we have available for staff, to make sure that they had the best provision for mental health as well as physical health, to ensure that we were able to have somewhere to signpost people to have resources available to support them and their families if they need them. So moving on from this, it was a natural progression for us to get involved with the diversity and maritime working groups that we're involved in, and there's a number of GAC people involved across them. And recently we signed the Mental Health and Maritime Pledge. So our managing director signed that, and we are working towards our charter status for diversity and maritime. We've got our panel at the end of March, so I'm really excited to be part of that group with what we're doing. The other key thing that we've done is that we've recently reviewed all of our HR and health and safety policies across the company to make sure that they're inclusive, to make sure that they're up to date and reflecting our focus on mental health as well as physical health. Coming from the safety field as a health and safety manager, it's there, but it's not always documented as well in businesses as it could be. So we've really reflected that across what we do. To make sure that everybody understands where they need to go. And we're also literally about to publish our mental health and wellbeing procedure that sits alongside all of that, which can be used as a tool by our staff to signpost them to relevant information that they require, how to access support, who they can go and speak to. We've had a very visible campaign for our mental health first aiders. Their pictures are up in every single one of our offices with their mobile numbers. And they're not, we really wanted to make it accessible. So those pictures are the sort of pictures that you would see on social media. They are us smiling in a field or wherever we would be. They're not sort of headshots that are taken from an office perspective. So we really wanted to make everything as accessible as possible. And our key aim as doing what we're doing internally is also then to look how we can support the wider industry with what we do in Ships Agency. Because quite often we're a point of contact with the vessel, so we understand, we're speaking to crew, we're dealing with crew changes, and if there's ways that we can support the wider industry to point, signpost, provide information, then that's how we wanted to move forward with what we're doing. So we're excited with moving forward with our charter status for diversity and maritime, and to see what we can do to bring some of the tools that we've had outside, that we've brought in internally to help support other companies within the industry and work together to really make it a positive place for mental health. So yeah, that's kind of an overview of where we are. So thank you for that. I'm passing on to Verity, I believe. So if I hand you across to Verity, thank you for your time.
Good morning, everybody. I don't know how I can follow from Laura's fantastic presentation, but I will try my best. So I'm from DP World Southampton, and just to talk to you a little bit about what we've done, where we're going, etc. So I'm part of this Maritime Mental Health Network. Why? So the obvious one is to share ideas and best practice. We don't want to be reinventing the wheel. If someone in another company has done something which works, then we obviously want to emulate that and maybe tweak it to suit our workforce. So that just makes sense. The other thing that appeals as well is industry specific. So there are other pledges, there's other charters out there, Time for Change, Mind, etc. And they're great framework to benchmark yourselves and give you areas to work on and have a think about. But what better than something more industry specific, where we understand the uniqueness of our workforce, of our industry, to be able to apply things that are specific to us. So things such as, so where I work, we have a male dominated workforce. That presents challenges in itself, because we know that statistically men are less likely to disclose they have a mental health issue, and there's stigma surrounding doing that. And as a result, men are more likely to engage in harmful coping mechanisms to help them cope with mental ill health, such as alcohol and drugs abuse, which obviously has an impact on the types of role they do, etc. So it just makes good sense to be part of a group that understands all of these issues and the uniqueness of our industry. I also have a personal interest in mental health, particularly the reducing stigma and all the myths around mental health. I think they've been around for a very long time. It's not helped with historic news items, which are sensationalist, if you like, instances of people who have committed a crime and they've said it's down to mental health issues. Well, that's not representative of people who are ill. They are the extreme side of it. Most people don't resort to that type of behaviour. So it's things like that we really need to break down, because they're just not right. And it's also, I believe in prevention rather than wait for someone to have a crisis or a mental health illness. So I'm very much interested in trying to prevent people from going down that road in the first place. So that's things such as, again, reducing the stigma, early signposting, and other things we can do to help people proactively look after their mental health as well. I also am passionate about a more collaborative approach to mental health. So mental health in an organisation, I think historically in the past there's been thoughts such as it's HR's responsibility, it's occupational health's responsibility, it's health and safety's responsibility. It's everyone's responsibility, just like with any health and safety issue. And because of that, we need everyone to get on board, get involved, and to help tackle mental health in the workplace. If someone has a mental health issue, they will eventually, hopefully, disclose to somebody. And that's the one chance we have to get our response right. So the education is really important. So if someone does disclose a mental health issue, and it could be to anyone, we need to make sure we get that, that conversation right, so that person can seek help and they're just not left isolated because they've had a negative experience of disclosing to somebody. Managers have a key role in helping to reduce stigma as well. That has to come from the top. I think we've had mentioned already people telling their stories about mental ill health, whether it's their own personal experience of having a condition themselves, or maybe they care for someone with a mental health issue. I think airing those stories and just saying, I understand, I think from a senior level is very important, and that sets the right tone for the workforce to start having those conversations as well. And following on from that, in DP World Southampton and our sister port London Gateway, we have an executive sponsor for our wellbeing group. So someone very senior, a figurehead who will mention these issues and champion them for us, and when necessary, help to break down some red tape if we need to deliver something. So one thing I would recommend is certainly having someone senior to help push the agenda. And again, I would recommend it's not someone you traditionally associate with such issues such as occupational health, health and safety. It's also important to engage the workforce. So an obvious source of information and support are union representatives. But like Laura, we also have, we call them wellbeing champions. We have more of a, well, Stu mentioned the macro, if you like, holistic view with policies, etc. I like to call it a kind of more of a micro holistic approach where we look at well-being as a whole. So it's not just about mental health. All the strands of well-being do interlink. So I mentioned drugs and alcohol earlier. So things such as physical activity, that's good for mental health as well. So we take a more micro holistic approach of well-being because it all connects. So we don't just look at mental health in isolation. again, it's about the preventative piece as well, because if you look after the other bits of well-being, then that all contributes to good mental health. Also, what's important we found as well is having that voice. It also, the champions also can educate the workforce as well for themselves as to knocking down the barriers, as to, you know, declaring mental health issues, helping to spot the signs of someone who may be starting to suffer a mental health illness. So again, it's back to the early intervention. Like Laura, our mental health, our wellbeing champions, they're not only trained in how to facilitate behaviour change to look after wellbeing as a whole, but also we're starting to train them as well as mental health first aiders, because they are the face, our frontline face, if you like, of wellbeing. We're not just training the wellbeing champions in mental health first aid, we're also training other staff. So it's not just volunteers, we're putting our managers through the course as well, so they can, again, understand what mental health is, spot early signs of mental ill health and intervene as and when required. So that's something else we've been doing over the last year. Bear with me. And also think about other organisations you could partner with for the collaborative approach. So we work very closely with our local public health teams. Yes, they've been busy over the last year, but they're also a really good source of information about what's available in terms of services locally. A lot of them are self-referrals for mental health. So it's just having that in your toolkit of support, as well as any EAPs, occupational health provision, that you already have. If they didn't want to go through something associated with the company, you could signpost people to those other services as well. As for the future, so we've run a strategy in Southampton locally over the last 2 or 3 years. We have a sister port in London Gateway, which is in Essex. So we're starting to look at something more UK based now, and to facilitate that work as a UK entity, we are benchmarking on this year's Mind wellbeing survey. So last year we did it as a terminal. This year we're going to be doing it as a UK entity, so we can have a more, excuse the pun, holistic view of the UK in terms of mental health and what we need to do as a whole. We've also just finished running our staff survey, our staff satisfaction survey. So we'll look at both survey results in tandem to see if there's any common themes and what else we can pick out to formulate an action plan. The other thing, Laura mentioned also, COVID is a very important issue. So we're very mindful of 2 particular issues. So people who may have had COVID and are developing long COVID, there's going to be mental health implications of that as well. So we have been in touch with our employee assistance programme and our private medical health provider, just to get an awareness of the services they're planning to offer to support people with those issues as well. And we've got that again in our toolkit ready to signpost staff to, should there be anyone who is suffering from long COVID and their families. And also we're very mindful of the people who've been working from home over the last year. Some people wouldn't have been in the office hardly at all since last March, and I think it's really important to phase them back into the workplace in a very considered way. There may have been less social contact, they may have been quite isolated, so going straight from working from home full time to working in the office full time might be too much for them at that particular time. And also we need to reassure people that we're COVID secure and all those sorts of issues as well. So we're very mindful that's a cohort of staff we need to think about over the coming year as well with our action plan and our strategy. I hope that's given you a brief overview of what we've been doing and why we're part of the group. So as ever, if there's any questions, feel free to ask away at the right time. Thank you.
Thanks so much, Verity, and thank you, Laura, as well. You both have given so much food for thought. I've made loads of notes myself, and just so many great initiatives, and just the amount of thought and work that's gone. I mean, all 3 of your organisations are really great examples. Before I see if there are any questions, I probably have a lot myself, but I had I thought that, you know, I should mention the fact that we, over time, we really will hone in on the particular challenges for different groups, and, you know, particularly for seafarers, because, you know, at the moment we're hearing from shore-based maritime organisations. But thinking about nearly everything that you've talked about is really applicable to policies that could apply for crew as well, and for seafarers, with certain changes. But before so we will talk about those particular challenges and resources, and mitigation for some of those challenges, and for seafarers themselves, but also for organisations pushing together policies with those considerations. But before I ask any particular questions, does any of the attendees have any questions for the panel? I know there's been some comments in the chat. There's some conversations going on there. If not, I might ask a couple of questions if that's okay, and then I give the panel some opportunities to ask some questions to each other as well, because I'm sure there are lots of learning experiences between you all, but it sounds like there's a lot of synergy between the ideas that you're having. I really loved, Laura, what you said about having all of the employees as part of the committees, when you started to talk about looking at mental health within GAC, and having the most senior people in the room, and all other employees across the organisation. I just wondered if you could elaborate on that a little bit more about how that worked in practice. Did you feel the real value of having people from all levels feed into the plan?
Yeah, absolutely. I think it was key for us that I never wanted it to be something that was introduced in as any sort of lip service. It needed to be part and active and involved at all levels across the business. And I think that the way I looked at it originally was that we really do, like, every different job role within our organisation comes with its own level of pressure and stress. So it was really understanding that we are all equal in the fact that we all have mental health, whether it's positive or negative. We all experience pressure, and various levels of pressure, which, quite often when people are looking at different initiatives, it's looking at one level within the business, whereas we understand that every level has different experiences. So it sort of happened quite naturally, to be honest, with the sort of senior management team. So myself, the other support services managers, our managing director, who was really supportive of it, we kind of started discussing it. And then at the same time, I had someone who was our first mental health first aider come to me and say, have you heard about mental health first aid training? I'd quite like to do it. So he then, and he sort of started it off, and then it was, we asked out to everyone what people were interested in. Did people want to join? Did they understand what this was about? And yeah, overwhelmingly straight away, we had a whole influx of people that volunteered and decided that they wanted to be part of it. And I think the key thing for us was, as I said, to make sure that it was accessible to everyone. So we're all equal in our team, in our wellbeing working group. And similar to what Verity was saying, we look at all aspects of wellbeing within that group, but we're all equal. There is no, someone's a manager and someone's, there's no overriding. It's a group decision when we look at the initiatives and everything that we're doing. And we also wanted it to be a real representation of our business. So gender-wise, age-wise, location-wise, because we've got offices, they're all coastal around the UK. So it was really to make sure that we were sort of almost scooping all those people up in the net, and that we had a real good representation of the people that will be turning to us, of our workforce, of our people. So yeah, hope that helps.
That's great, thanks so much. I have a couple of other questions, but Kim Fry has just asked something, so I think we'll go over to this and see who best to answer it. Kim said it very interested in how we support the staff that are themselves supporting others. Is this being achieved at a peer-to-peer level or through a professional supervision platform? Stu, I think you mentioned that. Do you mind answering this one?
But what I'll do is I'll perhaps answer the question that Ian has also raised as well, about spotting the signs in that respect. Unfortunately, I have direct experience of not being able to spot the signs, not within the workplace, but as a family member of mine took their own life. So that's kind of why it's quite important for me and everything else like that. So to be able to support my members of my family, I needed support from the organisation. So I was given really, really good support from my line manager. He was able to point me in the right direction, give me a little bit of space. The team that I have around me took up some slack from what I was able to deliver, not deliver in that respect, and that was solely because I was supporting my family at home. It was to the point where I also asked my line manager to see if I could have occupational health support, and have a chat with our occupational health physician and the nurse available to us within the organisation. And that wasn't really to find out what was going wrong or anything else with respect to me. It was, I was trying to manage 3 different things. I was trying to manage a team. I was trying to manage a team that also had problems within it, and trying to do the best thing for them. I was trying to deliver on quite a major project within the organisation, and I was also trying to manage things at home. So where was the space? Where was I able to vent my frustrations and everything else, and grieve for my family member and that side of things? Thankfully, I didn't need to take time off work, but there was a period of time within the workplace where there was support from everybody around to enable me to continue to act in my best way forward and deliver what I needed to deliver. I don't think I would be in the same position now if I wasn't having that support or having those open conversations to allow us to have that. So is there support within the organisation? Yes, there is, and it's that type of support that I would sort of go out and deliver and everything else like that. That's my own lived experience. Okay.
Sorry, everything froze for a moment there. Thanks so much for sharing that, Stu. And Kim, let us know if you need any further information on the peer support. But those lived experiences is just so important, and thank you for sharing it. We've got a few questions coming through the Q&A and on the chat as well, so I'm going to come to as many as I can. Sophie has asked is there a mental health standard people will adhere to assure a certain quality and clinical accuracy. Sophie, I'm not sure if you're referring to training specifically, or whether I suppose there might be a question for Verity or for Laura around, whether you might be consulted with clinicians or working to a particular standard when putting together your procedures. Is there anything, Verity, is there anything you could say about that?
Well, we work very closely with our occupational health unit, so they obviously adhere to their various standards of occupational health. So anything we do would obviously be checked by them to make sure it does approve, has approval at their standards. with regards to the councillors for our EAP, obviously they've got to conform to their regulatory bodies as well. So we do get that assurance through our EAP that the councillors are able to do the type of counselling we need to do at the required standard. I'm not sure if that was the question that was being asked, but that's kind of what we would do to make sure that the interventions we have are at the right level and to the quality that's required.
And I was just going to add, I don't know if it helps when it comes to the mental health first aid training, we booked it through, most of ours have been done either via St John's Ambulance or St Andrew's Ambulance in Scotland, because they run the mental health first aid at work programme that's supported by Mental Health First Aid England. So they're the sort of standard bearers of the training that you could go to potentially. We always choose to do our first aid training through charities. So.
Great, thank you both. We've had a question from Carol about, in terms of supporting colleagues return to office work following COVID restrictions, are there any suggestions as to how employers can support the mental health considerations at this time? I mean, Laura, you mentioned COVID first, but I mean, I think you and Verity both had some really useful things to say on it. Is there anything else you could say about that here?
Yeah, I think we have worked, as soon as we all put everyone to working from home, we sort of earmarked a strategy to getting everyone back in the office. So it's always been there. It's been there since last year. It was just as to when we were going to implement the plan. And so as part of what we've done with the working from home and building the sort of community side of it, we also have a strategy for looking after mental health when people return to the office and managing people's expectations, managing their thoughts and requirements, their concerns, and how we can address those. So we're looking at all different aspects of well, the world has changed. So we're looking at flexible working, we're looking at phased returns to offices, which could be long-term, or does it suit their work-life balance better to do half of the week at home or to permanently work from home? Is that good for them? So we've been looking at all of those aspects. So alongside the work that we're doing and the policy reviews and the procedure reviews, we've got tools that we've been putting together to support people in their mental health, because we know that people have struggled with working from home and it wasn't for them. Other people have anxiety about going back into the office and the feeling of being around lots of people again, particularly if they haven't had a vaccine, and that's been a concern for some people, or they don't want a vaccine. So I think for all of that, it's something that we've worked a lot with. And again, we've had a huge amount of support from our charity partners that we work with at Mind, at SAMH, with how to look at the coronavirus and mental health together and what you can do to manage that. There's a lot of resources out there. So
thanks. And Verity, is there anything else you wanted to say? Because you mentioned, you know, how much thought you've put into the phased approach back to the office.
Yeah, so similar, and certainly managers who've had to manage remotely over the last year, we've encouraged them to keep the engagement with their staff. Dare I say, if they're going to talk to them, make sure it's on video camera, because there's no better way of seeing how someone is by actually looking at them and seeing the person in front of you. Having a blank screen, hearing a voice, I don't think gives you the best representation of how that person is. So at this stage, managers should have a good understanding of how people have been coping with working from home. I agree with Laura. We've had the whole spectrum of people. There's been people who have been absolutely desperate to come back to work and really want to come back and really looking forward to it. And there's others who, through various reasons, maybe from isolation or because they don't, they've lost the, they've lost what society looks like in a realistic way. They have all these anxieties, so we might take a different approach, like a phased return, just to get them back into a routine, just to get them to test any beliefs they may have developed over the last year. And again, it's just keeping the reassurance that, you know, we are COVID secure. Here's the information where you can find that things we've put in place. even more innovative things, such as the manager walks around with a video camera around the office saying, this is what the office still looks like, here's the hand gel on the desks, everything's fine, this is what we put in place. So they can also see what the office looks like as well. So there's various different things we've put in place. And obviously we would consider an occupational health referral if a person was really worried about coming back into the office. And overlaying that is whether they do need to go back to the office full time, because if we decide their role is such where they could continue to do it part time from home, then why push them into attending full time? So it's balancing all those things to support people.
Thanks both for that. We have a question from Rachel. She's talking about it's sort of while we have you, Verity, saying, have you found any ways that managers can be encouraged to share their experiences? I think both you and Laura actually mentioned the importance of line managers having the right skills there and the right training. And I want to mention as well, particularly Verity mentioned that the mental protecting the mental health is everyone's responsibility. And so, yes, Rachel's asked, have you found any ways that managers can be encouraged to share their experiences to break down those stigma?
Well, my day role, apart from wellbeing, is I'm an HR business partner. So I'm quite lucky in that I do have probably a different relationship to management as maybe a normal employee, if you like. So I am able to have, if they're going to disclose that they have a mental health issue, it's not going to be to their management team, it's probably going to be me. So that gives me an in to, at the right time and using judgment, saying, are you prepared to even, partly tell your story and share your experience? And I've actually quite lucky in our terminal as well. We've actually had staff, frontline staff who've actually shared stories. So you can almost use those as a, as a lever, if you like, to say, look, he's told his story and it was received in a very sympathetic way. I think it'd be really powerful and support that member of staff if you're also to share your story. Obviously being respectful of boundaries and not pushing too hard, but just every now and again dropping in saying, even as a step change, do you want to tell it anonymously first? And then we can look at perhaps putting your name to it later on. So it's just being very mindful of their approach to it and just coming back and letting them very much lead it.
Thanks. Stu, did you have anything to add?
Just on that, from a leadership point of view, I'm very lucky and privileged in the sense that Robin is open to those conversations, and he has been part and parcel of sharing his own experiences on the film as well, and he is encouraging the rest of the exec team to share their experiences as well. So we do have a leadership team that is willing to start to open up and discuss their own vulnerabilities, as it were, or perceived vulnerabilities, to open that conversation. Just backtracking on the COVID impact and what we're planning, we're actually doing pretty much everything that Verity and Laura are saying, but we're also looking at putting in place something related to bad posture, especially around the individuals that have been working from home for the last year. They might have been sat at kitchen tables, dining room tables, and not necessarily a proper workstation and that side of things. So we can actually start to perhaps see the bad postures and habits that they've learned over the years, and they're going to start having bad backs and issues related to that. The reason why I raised that as a particular example, we have evidence that a person going to the doctor with a bad back and then seeing our physio is actually a mental health issue that is being created rather than a musculoskeletal injury or something like that. So there is a link that we are starting to see within the organisation that we can actually start to put the two together. So that's why we're perhaps focusing on the bad posture elements and that side of things for coming back after COVID and bringing back people to the workplace.
Brilliant. And I think we all know as well what sort of chronic pain and the links between that and poor mental health as well. So thanks for that, Stu. I've lost track of the order of questions a little bit, but there's something that's coming in the Q&A from Ian Wilson, who says thank you for taking the time to share all the great work going on, and to Stu for the personal account. From a seafarer's point of view, noting the impact COVID has had on the nation, within any of your strategies during this unprecedented period, have you looked to include families to also add to the piece really about working from home too? Thanks, Ian. It's a great question. I'm not sure who to go to on this. Has that come up for any of you, the consideration of families?
Yes. Again, lived experience. My wife works from home ordinarily. She used to go into London 1 day a week. COVID changed that completely for her. Not only was she not working from home on her own, quite happily doing her own thing and that side of things, she then all of a sudden had 2 teenage children within the household, one who was not doing their GCSEs and one at the beginning of their GCSEs, trying to manage that. And then myself, certainly during the first time that we had lockdown, in the house as well. So 4 people trying to do their own thing and not realizing the actual mental impact that it's actually had on my wife. And it is evident now that she did struggle during a period of time. She is struggling now. And that side of things. It wasn't so much of a struggle during the summer months, because we could go outside, we could sit in the garden, it was nice and warm, we could go out for long walks and everything else. But when the clocks changed and the weather changed, it became stuck with these same 4 walls. And these same 4 walls just says it all, really, and not realizing that there isn't that escapism. Not being able to go 10 miles down the road to a walk and sticking within 5-10 minutes the house to get your exercise wasn't particularly great and hasn't been particularly great. She's almost counting down the days at this precise moment in time to say when we can actually go out and meet her friends one-to-one outside, meet in groups of 6. That's what she's looking forward to. Plus the summer months, I think, is going to improve her mood and everything else like that. So supporting that way from a family aspect has been necessary, has been allowing her to have her own freedom, her own time. So it's almost taking the kids out of the situation and helping that scenario more than anything else. Has anything been done within the workplace? No, there hasn't.
Thanks for that, Stu. That's I can really sympathise. And just to come back to the mention of seafarers, ICE1, the organisation that I work for, has seen, firsthand the impact on the families of seafarers as well as seafarers themselves during, all year round, but particularly during the COVID specific issues. And so just before I come to the last question, just to mention that we've seen, on one hand, the terrible worries that it's caused, the uncertainty of how long a crew member might be at sea, and how long until they can return home from both sides. But we've also seen, the practical consequences of crew not being able to get home, such as the partners, wives of seafarers that have gone into early labour and have been seriously critically ill, and in normal circumstances it would have been a lot easier for crew members to make it home. And even without these extreme cases, just the increase in anxieties around the uncertainty that's there. So I think really great to mention families on both sides. Those of us working at home, like Stu's just illustrated how stressful it can be, these changes. And so I think it's really important that employers are considering all of these different situations, or can provide as much support as possible. I realised I missed Razor's question, which was I do realise the importance of getting it right first time when a mental health situation is reported, but what is the best course of action to keep the case private? I don't want to keep coming to you, Stu, but I think that you might be a good person to answer this question. So.
From a reporting point of view, and keeping confidentiality, all we record and we get the information from our occupational health physician, and not from the mental health first aiders or anything else like that, because they are confidential conversations and everything else. It's where we know that there is support being offered and everything else, and there is support from a PLA source, as opposed to finding information on their own back and that side of things. We will only record if somebody is suffering from stress, anxiety, or the primary symptom, and we won't know who it is, and just the numbers, and that is it, and that is all we know about where we are. The reason why we just get the headline news is so that we can perhaps focus any campaigns or targeted communications to help people and that side of things, and that's it.
And I suppose there's an important point raised there as well about probably training or awareness in around confidentiality, that very much feeds into all of the other training around supportive conversations and active listening. Sometimes it might not be so obvious to people about how data is recorded, or how conversations are recorded, whether they're recorded at all. So upskilling team members, across the organisation as much as possible, I suppose, is helpful there. So I think we've come to the end of our discussion. Thank you everyone so much for your questions, and thank you to the panelists for really insightful talks about your organisations. I hope that it's been very useful to all of the attendees here. It's been useful to me. I'm going to hand over to Chrissy to wrap up, but thank you again.
Thank you so much. Thank you so much, Caitlin, for hosting today, and to our fabulous panelists, to Stu, Verity and Laura, and also all the attendees for tuning in. We will be circulating the recording of this webinar afterwards. And as mentioned during this, please do join the Mental Health Network if you haven't already. Our next meeting is on the 8th of June. If you are interested in joining one of our project groups, either the Holistic Approach or the Culture of Care, feel free to drop me an email. I'll put that in the chat now. But without further ado, thank you so much to everyone for joining, and to the panelists. Thank you.